Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic.
Let's do a question. A 35-year-old man returns from a 2-week holiday in India. He presents with a 4-day history of fever, abdominal cramps, and frequent watery stools. He also reports nausea and general malaise. He drank tap water on multiple occasions and consumed street food. Which of the following is the most appropriate initial management? A. Start oral ciprofloxacin immediately. B. Administer intravenous fluid and antibiotic. C. Oral rehydration therapy and symptomatic treatment. D. Perform a stool culture and await for results before initiating treatment. E. Prescribe metronidazole for possible giardiosis. The correct option, if you recall, is going to be option C, which is oral rehydration therapy and symptomatic treatment. I think the other options are quite self-explanatory. There is no indication to start option A, as you're not sure that this is a bacterial infection and you don't have sensitivities at the moment. Option B is something that you might consider down the line depending on sensitivities and if the patient is not able to tolerate oral rehydration therapy. Option D is correct in that you do want to get a stool culture. However, you don't necessarily need to wait for the results to come back before you start the treatment with oral rehydration therapy. And option E is also incorrect. There isn't anything to suggest that this is giardiosis. Therefore, the treatment of the condition through generalized measures such as oral rehydration therapy remains the key.
So let's now try a question. A 55-year-old woman is admitted to hospital with fever and profuse watery diarrhea after recently being treated with antibiotics for a urinary tract infection. C. difficile infection is confirmed. What is the most appropriate infection control measure to prevent the spread of this infection? So our options are standard precautions with alcohol-based hand gel, contact precautions and thorough hand washing with soap and water, airborne precautions and use of N95 respirators, droplet precautions and surgical mask, or administer prophylactic antibiotics to all healthcare workers. So you will be aware, probably from your own clinical practice, that the correct answer here is B, contact precautions and thorough hand washing with soap and water.
So let's do some questions. Question 1. A 32-year-old man is bitten by a stray dog while traveling in a rural area of Southeast Asia. He did not receive a rabies vaccination prior to travel. He presents to the local clinic 8 hours after the bite and the wound is thoroughly cleaned. What is the best step in his management? Option A, administer rabies vaccine only. Option B, administer rabies immunoglobulin only. Option C, administer both rabies vaccine and rabies immunoglobulin. Option D, administer antibiotic and tetanus toxoid only. Option E, observe for symptoms, then consider treatment if symptoms develop. So if you recall, we talked about the importance of providing the treatment as soon as practically possible, regardless of development of any symptoms. Therefore, automatically you should know that option E is completely inappropriate. We also talked about the importance of providing both passive and active immunization, and that would come through administration of both immunoglobulin as well as the vaccine. Therefore, the correct option is going to be option C in here. Question 2. A 34-year-old man presents with fever, malaise, and paresthesia around the site of a dog bite he sustained 2 months ago while traveling in an area endemic for rabies. He begins to exhibit anxiety and episodes of agitation. Which of the following is the most common mode of rabies virus transmission to human? So the options you've got is A, inhalation of aerosolized virus particles, B, direct contact with saliva or body fluids, C, bite from an infected animal, D, contamination of open wound with animal urine, E, vertical transmission from mother to fetus. And this should be really straightforward for all of you, and the correct answer is going to be option C, which is from the bite of an infected animal.
So let's now try a question. A 22-year-old woman returns from a trip to Southeast Asia and presents to the emergency department with a 4-day history of fever, headache, and joint pain. On examination, she has a petechial rash and her platelet count is 90,000 per millimetre cubed. On day 5, she reports a sudden improvement in her fever, but shortly afterwards, she develops severe abdominal pain and dizziness. What is the most likely explanation for her current symptoms? So our options are development of dengue hemorrhagic fever, resolution of acute dengue fever, superimposed bacterial infection, acute viral hepatitis, or onset of chikungunya fever. So based on what we've discussed in the video, this looks like a classic case of development of hemorrhagic fever. And as we said, this would be a notifiable disease.
Let's do a question. A 28-year-old man returns from a trip to South America and presents with fever, headache, muscle pain, and a maculopapular rash. He reports multiple mosquito bites during his trip. His blood tests show thrombocytopenia and a mild increase in liver enzymes. Which of the following vectors is most likely responsible for transmitting the virus causing his symptoms? The options are A, Aedes mosquito, B, Culex mosquito, C, Anopheles mosquito, D, Ixodes tick, E, sandfly. So some of you may be familiar with this, that this is quite a common infection in South America and Southeast Asia, which presents with quite non-specific symptoms such as the headache, muscle pain and fever, as well as a transient rise in liver enzymes and thrombocytopenia. This is of course dengue, and therefore the correct answer is going to be option A, which is Aedes mosquito. Let's do some questions. A 35-year-old man presents with fever, weight loss, abdominal pain, and splenomegaly after returning from a trip to India. Laboratory test reveals pancytopenia, elevated liver enzyme, and hypergammaglobulinemia. A bone marrow biopsy demonstrates the presence of Leishmania donovi, a mastigotes, within macrophages. Which of the following is the most appropriate initial treatment? Option A is miltefosine, option B is ivermectin, option C is liposomal amphotericin B, option D is primaquine, and option E is pentadamine. So here they've already told you that the diagnosis is Leishmania donovi, but they want you to think about the correct option for treatment. So hopefully by reading this scenario, you would have come to the conclusion that this is consistent with visceral leishmaniasis, and therefore the correct option for treatment is going to be option C, which is liposomal amphotericin B.
So we're now going to do some questions. First one is as follows. A 5-year-old boy presents to the emergency department with fever, cough, coryza, and conjunctivitis. A red maculopapular rash appears from behind his ears, spreading down to his trunk and limbs over the next few days. Spots within the mouth are noted on examination, which are grey in colour on a red base. He is not fully vaccinated. Which of the following is the most likely causative agent of this child's symptoms? So our options are influenza A virus, respiratory syncytial virus or RSV, measles virus, mumps virus, or parainfluenza virus. So from earlier in our presentation, you should be aware that in this case, measles is the correct answer. And hopefully you've remembered that those spots that are described are Koplik spots, which present within the mouth. Which of the following viruses is not a member of the Paramyxoviruses family? So our options are measles virus, mumps virus, RSV, influenza A, or parainfluenza virus. So you really should recognise the first three because we've gone into depth about those. So measles, mumps, and RSV are all part of this family. Parainfluenza virus is also part of the Paramyxoviruses family. So the correct answer here is D, influenza A virus. And if you do want to brush up your knowledge on influenza A, you can rewatch our video on this particular virus, which is available earlier in the Infectious Diseases series, or if you just click the link at the top of your page right now. A 65-year-old man with a history of COPD is admitted to the hospital with worsening dyspnea, productive cough, and fever. His chest X-ray shows bilateral infiltrates. A nasopharyngeal swab is positive for RSV. What is the most likely reason for the increased severity of RSV in this patient? So our options are incomplete vaccination, pre-existing lung disease, viral mutation, immunosenescence, or bacterial superinfection. Now, while all of these in theory may be possible, we have to think about the most likely cause from the information we've been given. And in this case, the correct answer is B, pre-existing lung disease, because we've been given that information as a certainty. And also, having had COPD for a number of years, most likely, and given the comorbidity that comes with that, that is probably the most likely reason that this patient will suffer a more severe bout of RSV. So now let's do a question. A 32-year-old woman presents with progressive weakness in her lower limbs, which started a week after she recovered from a flu-like illness. She has a history of poliomyelitis as a child, which affected her left leg. On examination, there is new muscle weakness in her previously unaffected right leg. Her respiratory function is normal and there are no signs of sensory loss. What is the most likely explanation for her current symptoms? So our options are Guillain-Barré syndrome, post-polio syndrome, recurrent poliovirus infection, myasthenia gravis, or peripheral neuropathy. Now, from what we've discussed, this presentation classically fits with post-polio syndrome, particularly when we can see that she has a history of poliomyelitis as a child. And this can happen many years later. Post-polio syndrome does not necessarily occur in the months or even years after the infection. So in this case, B is the correct answer.
Okay, let's do some questions. A 40-year-old healthcare worker presents with fever, dry cough, and shortness of breath. She recently returned from Saudi Arabia, where she did various activities, including camping in the desert and hiking with camels. On examination, she is febrile, tachypnic, and has bilateral crackles on lung auscultation. Chest X-ray reveals bilateral infiltrates. Which of the following is the most likely cause of her symptoms? The options are A, influenza virus, B, Middle East respiratory syndrome or MERS, C, respiratory syncytial virus or RSV, D, SARS-CoV-2, E, Legionella pneumonia. So technically, in real life, all of those options can be correct. However, given the fact that you're preparing for an MRCP exam, it's important to try to look for the hints on the question caveat to try to guide you to the correct option. So this is somebody who has been traveling in Saudi Arabia and she's presenting with signs and symptoms consistent with pneumonia. And therefore, the correct option is going to be B, or Middle Eastern respiratory syndrome.
Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.